Every year, millions of seniors go under anesthesia completely unprepared for what's about to happen to their bodies. And many of them never fully recover. Not because of the surgery, because of the anesthesia itself. What your doctor tells you before you go under is only a fraction of the truth. Today, I'm going to show you exactly what happens inside your brain and body during those hours you can't remember, and why, after the age of 60, everything changes. Stay with me until the end, because what I'm going to reveal at the closing of this video could literally save your life, or the life of someone you love. There is one critical thing that happens in the hours after anesthesia that almost nobody prepares for, and it affects nearly 1 in 3 seniors who undergo surgery. 1 in 3. And most doctors never bring it up. If you've ever had surgery or if you know someone who has, hit that like button right now, because this information could change everything. I'm Dr. Patricia Holloway, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have sat beside hundreds of patients over 60 as they prepared for surgery, held their hands as they came out of anesthesia confused and frightened, and watched what happened in the days and weeks that followed. What I'm about to share goes against the comfortable story most hospitals want you to believe. The idea that anesthesia is simple, routine, and completely safe. I've seen too much to stay silent. So today, I'm telling you the truth. Before we go any further, I want to ask you something. Have you or someone you love ever had surgery after the age of 60? If yes, type surgery in the comments below. You might be surprised how many people watching this right now share that experience, and your comment could help someone feel less alone. Now let's start from the very beginning. The moment the anesthesiologist tells you to count backward from 10. Here's what's happening inside your body right now, in this exact moment, as you watch this. Your brain is running on a constant, invisible electrical current. Billions of neurons firing signals back and forth, maintaining your awareness, your memory, your ability to feel, to breathe, to exist as you. Anesthesia doesn't simply put you to sleep. That's the comfortable lie. What it actually does is far more complex, and for people over 60, far more consequential. General anesthesia works by flooding your central nervous system with chemical agents that interrupt normal neural communication. It is, in the most literal sense, a controlled and reversible form of unconsciousness. But the word reversible is doing a lot of heavy lifting in that sentence. Because after 60, the reversal isn't always clean, it isn't always fast, and it isn't always complete. Here's what terrifies me most. The aging brain processes anesthesia differently than a younger brain. After 60, the liver slows its ability to metabolize medications. The kidneys filter more slowly. The blood-brain barrier becomes more permeable. This means anesthetic agents stay in your system longer, travel deeper into brain tissue, and leave behind a biochemical wake that can take days, weeks, or even months to fully clear. The medical community has known about this for decades, and yet, the pre-surgery conversation most seniors receive is 5 minutes long and focused almost entirely on the procedure itself, not on what the drugs will do to their brain. A 2019 study published in the British Journal of Anesthesia found that adults over 65 are significantly more vulnerable to postoperative cognitive changes than younger patients, with effects that can persist well beyond the hospital stay. Another landmark study in Frontiers in Aging Neuroscience demonstrated that certain volatile anesthetic agents can trigger neuroinflammation in older brains, the same type of inflammation associated with early cognitive decline. Let that sink in. The drugs designed to protect you during surgery may, in some cases, be quietly accelerating changes in the very organ that makes you who you are. This isn't meant to terrify you. Surgery saves lives. Anesthesia makes that possible, but knowledge is your most powerful protection. And today, I'm going to give you that knowledge, step by step, stage by stage, starting with the moment they put the mask on your face. Let's walk through exactly what happens. I want to take you inside the experience because understanding each phase will help you recognize what's normal and what deserves immediate attention. Stage 1. The induction phase. This is the moment anesthesia begins. You are given either an inhalation agent through a mask or an intravenous drug directly into your bloodstream. The most common induction agent used today is propofol, the same drug that became notorious in news stories about celebrity deaths. It works within 30 to 45 seconds. You don't fall asleep gradually the way you do at home in your bed. One moment you are aware, the next moment you are not. There is no transition, no gentle fading. You simply stop. For a younger brain, this is manageable. For a brain over 60, this sudden chemical shutdown can be more jarring at a cellular level than most people realize. The neurons that have been firing for 6 or 7 decades suddenly go dark, and that darkness has consequences that begin before you even wake up. Stage 2. Maintenance. During your surgery, you are kept unconscious through a continuous delivery of anesthetic gas, intravenous agents, or a combination of both. Your anesthesiologist monitors your vital signs and adjusts the dosage in real time. This phase can last anywhere from 30 minutes for minor procedures to 6, 7, even 8 hours for complex operations. And here is where something critical happens, something that almost no pre-surgical nurse or surgeon will mention. At around the 2-hour mark and beyond, the cumulative exposure to anesthetic agents in older patients begins to affect a region of the brain called the hippocampus. This is your memory center, the structure responsible for forming new memories and consolidating experiences. Research from the Journal of Clinical Investigation found that prolonged anesthesia exposure can temporarily disrupt hippocampal function in older adults, leaving patients in a window of vulnerability that can last hours or even days after they wake up. I remember Barbara, a 74-year-old retired school teacher from Minneapolis. She had a hip replacement, a routine procedure, successful by every surgical measure. But when she woke up in recovery, she didn't recognize her daughter sitting right beside her. She thought she was still in 1987. She was asking about students who had graduated decades ago. Her daughter was terrified. She called for a nurse. She was told, "It's just the anesthesia. It'll wear off." And it did, mostly. But Barbara told me 3 weeks later in my office that she still felt like something was slightly off. Words took a moment longer to come. Names slipped away. She felt like she was living with a thin fog over her thoughts that hadn't been there before her surgery. What Barbara experienced has a name: postoperative cognitive dysfunction, POCD, and it is far more common than most people are told. If this is resonating with you, if you or someone you love has experienced mental fog or confusion after surgery, type POCD in the comments. I read every single comment, and I want to know your story. Stage 3. Emergence. This is the phase where the anesthesia is stopped and your body is allowed to begin clearing the drugs. For younger patients, this process takes roughly 15 to 30 minutes. For patients over 60, the timeline extends. The liver and kidneys are working more slowly. The brain is taking longer to reestablish its normal electrical patterns. The drugs linger. During emergence, something called emergence delirium can occur, particularly in older adults. This is a state of acute confusion, agitation, and sometimes profound distress that happens while the brain is trying to reconnect its circuits. Patients may thrash, call out, seem terrified. They may not know where they are. They may believe they are somewhere else entirely. A 2021 meta-analysis published in the Journal of the American Geriatric Society found that emergence delirium occurs in up to 25% of elderly surgical patients, 1 in 4. And it is associated with longer hospital stays, higher rates of postoperative complications, and greater risk of long-term cognitive decline. But here's what I want you to understand. Emergence delirium and postoperative cognitive dysfunction are not random. They are not simply bad luck. There are specific risk factors that dramatically increase your chances, and knowing them gives you the power to reduce your risk. Before we continue, if you're finding this information valuable, something your doctor probably hasn't told you in this much detail, please hit that like button and subscribe to this channel. My mission is to give adults over 60 real, honest, clear health information so you can make the best possible decisions. And share this video. Think about every person you know who is scheduled for surgery, who has a parent going in for a procedure, who has a friend recovering right now. A simple share could make a profound difference. Now let's talk about the risk factors for cognitive complications after anesthesia, because this is where you have real power. Risk factor number 1, pre-existing cognitive vulnerability. This doesn't mean you have dementia. It doesn't even mean anyone has noticed anything unusual about your memory. But if you are over 70, if you occasionally feel like your processing speed has slowed slightly, if you sometimes struggle to recall names that used to come easily, your brain is already operating with less cognitive reserve than it once had. This matters because the brain uses cognitive reserve as a buffer during stressful events, including anesthesia exposure. The lower your reserve, the less buffer you have. The less buffer you have, the more vulnerable you are to the disruptions anesthesia causes. A landmark study from University College London found that patients with even subtle pre-existing cognitive changes were 3 times more likely to experience significant post-operative cognitive dysfunction than patients with no detectable baseline changes. 3 times. Risk factor number 2, the length of anesthesia exposure. The data here is remarkably consistent across multiple studies. Every additional hour under general anesthesia increases cognitive risk in older adults. Procedures lasting more than 2 hours carry meaningfully higher risk than shorter ones. Procedures lasting more than 4 hours carry substantially higher risk still. This doesn't mean you should refuse a necessary long surgery, but it does mean you should ask questions. Is any part of this procedure avoidable? Is there a less invasive approach? Is regional anesthesia, where only a portion of your body is numbed, an option instead of general anesthesia? I had a patient, James, a 78-year-old retired engineer from Atlanta. He was scheduled for a procedure his orthopedic surgeon had planned as a 4-hour operation under general anesthesia. James came to see me first because something felt wrong to him, but he couldn't name what it was. I reviewed his surgical plan, asked some questions, and together we went back to his surgeon and asked whether a spinal block with sedation was possible for his case. The surgeon said yes. The procedure took 2 hours. James recovered quickly, remained sharp throughout the entire process, and 6 weeks later he told me, "Doctor, I feel completely like myself. I was terrified I wouldn't." James was right to be terrified, and he was right to ask the question. Risk factor number 3, polypharmacy. This is a term that describes taking multiple medications simultaneously. Among adults over 60, polypharmacy is extraordinarily common. Many people are managing 5, 6, 7 or more daily medications. Blood pressure medications, cholesterol drugs, diabetes medications, thyroid medications, sleep aids, anxiety medications, pain relievers. Each of these interacts with anesthetic agents in ways that are complex and not always fully predictable. Certain classes of medications, particularly benzodiazepines, anticholinergics, and opioids, compound the cognitive burden of anesthesia significantly. A 2020 study in the journal Drugs and Aging found that seniors taking 5 or more medications had nearly twice the rate of postoperative cognitive complications compared to those on fewer drugs. If you are managing multiple medications and you have surgery coming up, this is not a detail to leave to chance. Bring your complete medication list, every single thing you take, including supplements, to every pre-surgical appointment. Ask your anesthesiologist directly. Are any of these medications a concern for my cognitive recovery? If you take 5 or more medications every day, type 5 in the comments right now. You would be surprised how many people watching this share that reality. Risk factor number 4, inflammation and underlying health conditions. This is one that surprises people most. Conditions like diabetes, high blood pressure, cardiovascular disease, obesity, and even chronic joint pain create a baseline state of low-level systemic inflammation in the body. And inflammation, particularly in the brain, dramatically amplifies the cognitive impact of anesthesia. The reason comes down to a process called neuroinflammation. When the brain is exposed to anesthetic agents, it mounts an immune-like response, releasing inflammatory compounds called cytokines. In a healthy, younger brain with low baseline inflammation, this response is mild and temporary. In an older brain that is already dealing with chronic systemic inflammation, this response can become exaggerated, prolonged, and far more damaging to delicate neural tissue. Research published in Frontiers in Aging Neuroscience demonstrated that markers of systemic inflammation measured before surgery were among the strongest predictors of cognitive outcomes after surgery in patients over 65. The higher the pre-surgical inflammation, the worse the cognitive outcome. This means something important. The work you do before surgery, the months or weeks leading up to your procedure, can meaningfully affect how your brain responds. And there are specific things you can do. Before I tell you what those things are, I want to share something with you. One more story that I think about often. I remember Patricia, a 71-year-old retired nurse from Boston. She was one of the most mentally sharp people I had ever met. Fast, funny, medically literate in a way that most of my patients are not. She was scheduled for cardiac surgery. Before her procedure, she came to my office and said, "Patricia, I know what anesthesia does. I know the risks. I'm terrified of losing my mind, even temporarily. What can I do?" We spent an hour together building a protocol, a set of specific evidence-based actions she would take in the 6 weeks before her surgery, during her recovery, and in the months that followed. Her surgery went well. The cardiac procedure was a success. In recovery, she was confused for about 8 hours, which is normal. But within 48 hours, she was reading. Within a week, she was doing crosswords. Within 3 weeks, she was calling me to tell me about an article she'd read on postoperative neuroplasticity. She did not escape the temporary effects. Nobody does. But she recovered faster, more completely, and with less distress than most patients her age who go through similar procedures, because she prepared. And that preparation is available to you too. Now let's talk about what you can actually do. Because this is the part I care most about, not the fear, the power. Step 1. Request a pre-anesthesia consultation with your anesthesiologist, not just the surgeon. Many hospitals will schedule this if you ask. Use that appointment to discuss your specific cognitive risk factors, to ask whether regional anesthesia is appropriate for your case, and to review your full medication list together. Come with written questions. Bring a family member or trusted friend to take notes. Step 2. Reduce inflammation before surgery through diet. In the 4 to 6 weeks before a scheduled procedure, prioritize anti-inflammatory foods. Fatty fish rich in omega-3s like salmon and mackerel. Leafy greens like spinach and kale. Blueberries and other dark berries. Olive oil. Turmeric with black pepper. Ginger. These are not miracle cures, but they are measurable interventions. A 2022 study in the journal Nutrients found that a Mediterranean-style diet in the weeks before surgery was associated with a 31% reduction in markers of neuroinflammation in older patients. 31%. Simply from changing what was on the plate. Step 3. Prioritize sleep aggressively before surgery. Sleep is when the brain does its deepest repair work. A process called glymphatic clearance, your brain's overnight cleaning system, clears out metabolic waste, including the same inflammatory proteins that contribute to cognitive dysfunction. A study published in Science found that even one night of poor sleep before a major stressor significantly impairs cognitive recovery afterward. In the 2 weeks before your procedure, protect your sleep like it is a medical treatment. Because it is. Step 4. Stay physically active for as long as safely possible before your procedure. Even moderate activity, 30 minutes of walking most days, increases cerebral blood flow, supports neuroplasticity, and builds the cognitive reserve that protects you during and after anesthesia. Research from the Journal of Applied Physiology found that patients who were physically active in the months before surgery had significantly better cognitive outcomes in the months after. The brain that is exercised is more resilient. Period. Step 5. After surgery, insist on early cognitive stimulation during recovery. This is one of the most important and most overlooked aspects of postoperative care. As soon as you are medically cleared, typically within the first 24 to 48 hours, begin gentle cognitive engagement, conversation, listening to familiar music, simple reading, looking at family photos, and talking about the memories they hold. These activities help your brain rebuild its normal firing patterns more quickly. The brain that is gently engaged during recovery recovers faster than one left in passive rest and silence. A 2023 study in Frontiers in Neuroscience found that patients who received structured cognitive stimulation beginning within 48 hours of surgery showed a 40% faster return to baseline cognitive function compared to patients who received standard care alone. 40% faster, simply by gently using the brain earlier. Step 6. Watch for the warning signs in the days and weeks after surgery. Know what is normal and what is not. Normal after anesthesia for seniors includes some grogginess, mild confusion in the first few hours, difficulty with concentration for the first day or two, emotional sensitivity, and mood fluctuation during recovery. These pass. What deserves medical attention and should not be dismissed as just the anesthesia wearing off includes confusion that persists or worsens beyond the first 72 hours, significant memory gaps for events that happened before the surgery, personality changes that don't resolve, difficulty with tasks that were previously effortless, or new problems with balance or coordination. If any of these signs appear and persist, you deserve a proper medical evaluation, not reassurance. Push for it. Step 7. Consider talking to your doctor about the potential protective role of certain supplements in the weeks before and after surgery. I want to be careful here because no supplement replaces medical care, and you must discuss everything with your physician before a procedure. But the research on omega-3 fatty acids and their role in reducing neuroinflammation is compelling. The data on magnesium glycinate and its role in supporting neural recovery is promising. And there is emerging evidence around the role of vitamin D levels in cognitive outcomes after anesthesia, with one study finding that patients with optimal vitamin D levels had significantly lower rates of postoperative delirium. Talk to your doctor. Ask the questions. The right physician will take your concerns seriously. Now let me give you the practical summary. Your complete action plan. In the 6 weeks before surgery, shift your diet toward anti-inflammatory choices. More fish, more leafy greens, more berries, more olive oil. Reduce processed foods, refined sugars, and alcohol. In the 4 weeks before surgery, protect your sleep. 7 to 8 hours minimum. A consistent bedtime. A dark, cool room. No screens in the hour before bed. In the 2 weeks before surgery, get a complete medication review with your anesthesiologist. Ask specifically about which of your current medications may interact with anesthetic agents. In the days before surgery, walk. Even if it's gentle, even if it's slow, keep that blood moving to your brain. In the 24 hours before surgery, hydrate well unless instructed otherwise by your surgical team. Dehydration at the time of anesthesia worsens cognitive recovery. After surgery, start talking. Start listening. Start thinking gently. As soon as you are medically cleared, bring familiar music, bring photos. Ask a family member to tell you stories you already know. These gentle sparks of recognition help the brain find its way back faster. And in the weeks after surgery, be patient with yourself, but stay watchful. Give yourself grace as you recover. But do not accept persistent confusion, unusual forgetfulness, or significant personality changes as simply part of aging or part of recovery. You deserve to get your sharpness back. Fight for it. I remember what Patricia, my retired nurse from Boston, said to me at her 3-month follow-up. She said, "You know what I wish someone had told me 20 years ago? That the brain can be protected, that it can be strengthened, that aging doesn't mean surrendering it." She was right, and that is my message to you today. Not panic, not fear, knowledge, preparation, advocacy for yourself. Here is my challenge to you. If you have surgery coming up, make one appointment this week. Call your surgical team and ask for a pre-anesthesia consultation. That single step could be the most important thing you do for your brain before you ever walk into that operating room. If you're not scheduled for surgery but someone you love is, share this video with them today. Right now, don't wait. The information in this video could genuinely change the quality of someone's recovery. And if this video helped you understand something you didn't understand before, smash that like button. Subscribe to this channel. We are here every week with honest, clear, science-backed health information for adults over 60. Because you deserve the truth, and you deserve to be prepared. Now I want to hear from you. Have you or a loved one experienced cognitive changes after surgery? Did anyone warn you about this beforehand? Share your experience in the comments. I read every single one, and your story might be exactly what someone else watching this video needs to hear. Because remember, aging doesn't take away your brain's ability to recover. It simply reminds you to protect it with everything you have. Take care of yourself.